Exposure to toxic substances due to domestic work. One thing we want to share is why this is important here in California. The U.S. Labor Bureau estimates that there are close to 900,000 domestic workers, but we know that this is an undercount because domestic work is primarily privately employed. Domestic work is also one of the fastest growing industries, and California alone employs the largest number of domestic workers. One thing to note and clarify and just reiterate throughout the presentation is that for the purposes of our efforts, we want to provide health education to domestic workers who specifically work in housekeeping, which for our purposes is about 54% of the population of domestic workers. Another reason why public health needs to dedicate more efforts to this population are that there are many reasons why domestic workers are already an increasingly vulnerable population. A lot of domestic workers are migrant workers, and a majority of them are women. There are also a couple of things related to domestic work that create increased exposure. A couple of things, for example, are their need to take on more than one job, primarily because they're only contracted for a few hours a month. And then also because they would tend to work in a lot of the same places for long periods of time. And so increasingly being exposed to toxic substances due to their work, which is why we want to focus our efforts on providing health education to this community. Our primary audience are domestic workers, also known as housekeepers. We also want to target a primarily female and Latino population from ages 18 to 65 years old that live in North County, San Diego. The health behavior we want to cover is engaging in protective behaviors. Here are some examples: wearing gloves, wearing covered-toed shoes, ventilation, and proper disposal of hazardous products. Our intervention will be based on the health belief model. There are core staples for our intervention that we want to focus on, like perceived benefits, perceived barriers, and perceived threat. Some of our sample messaging will be: danger can be found closer than you know. Wearing gloves can help you be healthy in the workplace. Our intervention has three main components. The first one being community outreach, a one-time presentation, and a text messaging campaign. For our evaluation, we plan on evaluating number of individuals reached, number of individuals subscribed to the text messaging campaign, pre and post tests, and text-based evaluation questions like, was this information helpful, or do you plan on implementing any of the techniques shared with you? This project was by Carina Esquivel and Herminia Ledesma. Thank you.